Hello students, I am Dr. Nidhi Gupta. I am a faculty at the Center for Population Health and Development at the School of Development Studies, Tata Institute of Social Sciences, Mumbai. I welcome you to the module on menopausal women and their health problems, which is a part of the paper on population and health. Before we begin the module, let me familiarize you with the objectives of the module. The main objectives of this module are to familiarize you with the importance of studying menopausal women as a separate group and to understand the key health issues experienced by menopausal women and the implications of health issues of menopausal women on the public health policy. To get introduced to this topic, let us understand that women experience multiple morbidities throughout their life course, and these morbidities have a cumulative effect on their health in the later life. This is more significant in developing countries and in the context of countries like India, where patriarchy plays an important role and exposes women to unequal rights, not just in participation in households, decision making, the access to resources, but also in their own reproductive rights. Though attention to women's health is important at all the stages of their life, health among the middle-aged and the elderly women has not received sufficient attention by either policymakers or the program implementers. Hence, it is important to focus on the health of women in the menopausal stages. In order to improve the women's quality of life and guarantee a long-lasting and active role for middle-aged and elderly women in the society, prevention of chronic diseases and disabilities are the key aspects. Let me take you through a few definitions which will help you to understand the concepts better as we move in this module. We need to understand what do we actually mean by menopause. Menopause is the point in a woman's life at which she is no longer fertile and menstrual periods have ceased. The process does not occur overnight but follows a gradual process when ovulation stops and the estrogen hormones drop. Hence, it is a process. It is not just one event. Menopause can be accompanied by physical symptoms in some women like hot flushes or night sweats. Menopause is the time point at which a woman has not had a menstrual period for 12 months. So, menopause, though it is a phase, but we say that a woman has achieved menopause if she has not had the periods for the last 12 months. There are some more terminologies that are used, like perimenopause. Perimenopause is the time leading up to menopause, and the symptoms of the transition can take 2 to 10 years. Menopause is not a disease, but should be seen as a positive beginning of a new phase of life with opportunities to take preventive action against the major health risks. Menopausal women is the term which is used to describe women undergoing menopause and those who have attained menopause. Hence, it is collectively used to denote women in the perimenopausal phase, menopausal phase, and the postmenopausal phase. Let us now look at the few signs and symptoms of menopause. Menopause accompanies with a lot of signs and symptoms, so some of them have been described here. Hot flushes is one of the important symptoms that we see among menopause and majority of the women undergoing menopause. Hot flushes, that is the feeling of warmth that spreads over the body and is among the most common symptom of menopause. Hot flushes often increase the skin temperature and the pulse, and they can cause insomnia or sleeplessness. It can be accompanied with flushed skin or reddened skin, palpitations, which means the feeling of strong heartbeat, and sweating. Like hot flushes, another important symptom that is observed among menopausal women is urinary incontinence and burning on micturition. And women undergo various types of urinary incontinence like stress incontinence when there is leakage of urine, when they sneeze, laugh, cough, etc. And urge incontinence, which means that you can't hold the urine until you go to the toilet. And there are various other types of incontinence that may be accompanied as a feature of menopause. Vaginal changes are some vaginal changes that occur during the menopause, which often affect the vaginal lining due to the depletion of the estrogen levels Many menopausal women undergo vaginal changes, which leads to thinning of the vaginal lining due to depletion in estrogen levels. And perimenopausal women may also have pain during intercourse and may note a change in the vaginal discharge. Bone loss is another important sign observed in menopausal women, where there is a rapid bone loss among the perimenopausal years. Low bone mineral density can cause conditions like osteoporosis, a condition that increases the risk of bone fractures. We also observe changes in the cholesterol profile among the menopausal women. The cholesterol profiles also change significantly at the time of menopause. Total cholesterol and the low density lipids, which is usually referred to as the bad cholesterol, it increases. Increased LDL cholesterol is associated with an increased risk of heart diseases, though it is not very clear as to exactly how much of the risk of heart diseases is due to aging and how much is caused due to the hormonal changes that occur at the time of menopause. Some more symptoms that accompany the menopausal process among menopausal women are changes in the metabolism of the women when women tend to gain weight, and other changes like changes in the shape of the breast, thinning of their skin, and these are some of these changes that take place in the external appearance of their bodies. Another important symptom observed in menopausal women is the fluctuations in the blood sugar level. Estrogen is responsible for lowering the blood sugar levels, while progesterone is responsible for increasing the blood glucose level. As the hormones fluctuate greatly, this leads to spikes and drop in the blood glucose level of the postmenopausal women. Another important symptom observed in menopausal women is the metabolic syndrome. Some of the women in perimenopausal phase are at a higher risk of metabolic syndrome, which is characterized by high levels of blood glucose and insulin levels. Diabetes is characterized by high level of blood glucose levels and insulin levels from anywhere high to an absence of insulin activity. Now that we have understood the various signs and symptoms that are observed in the menopausal women, we should look at the major health issues of menopausal women. Middle-aged and elderly women may experience a variety of disorders which may affect their quality of life, as it leads to disability and sometimes death, if these health issues are ignored or neglected. Menopausal women are not a homogeneous group, as the disease prevalence differs between women aged 50 to 69 and women aged over 70 years, as per the Global Burden of Disease Report 2015. Several risk factors for disability and death among women over 50 years have been indicated in the Global Burden of Disease Report 2015, which include dietary risk, metabolic factors like high blood pressure and total cholesterol levels, high and low body mass index, that is BMI, and sedentary lifestyles, that is physical inactivity, smoking and alcohol. Some of the major health issues or morbidities experienced by perimenopausal and postmenopausal women are cardiovascular diseases, musculoskeletal diseases, cancer, dementia, chronic respiratory diseases, diabetes, sleep disturbances, migraine and depression, and we are going to look at each one of them in detail. Cardiovascular diseases. Cardiovascular diseases are the leading cause of morbidity, disability and mortality among women, especially in the developed countries. According to the Global Burden of Disease Report 2015, about 54% of all the deaths and 39% of all the disability among women over 70 was caused by the cardiovascular diseases, while in women aged 50 to 69, the corresponding percentages are 31% and 18%. Why are women more prone to the cardiovascular diseases? It is primarily due to the loss of the ovarian function, the hormonal changes, in addition to the changes in nutrition and lifestyle, which increases the risk of cardiovascular diseases among the menopausal women. The management of cardiovascular diseases focuses primarily on the lifestyle modifications and the management of weight and obesity, among other interventions, though hormonal replacement therapy has not been proved to be useful to control the CVDs among this cohort. Another important health condition that appears in the postmenopausal women is the musculoskeletal disorders. Menopausal women experience high disability rates as a consequence of musculoskeletal disorders like osteoporosis and osteoarthritis. Osteoporosis is a condition that results from reduced bone mineral density resulting in fractures in old age. The bone mineral density depletes steeply in the postmenopausal women. Osteoarthritis is another important condition experienced by the postmenopausal women, which is a joint disorder which is usually experienced in the elderly age. It is characterized by the breakdown of the joint's cartilage. Osteoarthritis is observed to be common among older women than men and is the leading cause of disability among them. Cancer, as we all know, is today's biggest challenge, and it is the important health concern, especially in the postmenopausal women. Cancer is becoming the leading cause of disability as well as death globally. Some of the cancers are more prevalent among women of menopausal age, given the changes that take place in their physiology and the cumulative effect of the nutritional deficiencies over their life course and their lifestyles. Most common types of cancers among the middle-aged and the elderly women are the cancers of the reproductive organs like their cancers of ovaries, cervix, breast and other vital organs like lungs and the pancreas. Cancers of various types lead to over 2/5 of the total deaths among women aged 50 to 69 years and about 15% deaths among the women 70 years and older. Older women, especially the postmenopausal women, also experience diseases related to the cognitive decline. Another important health concern experienced by the menopausal women is the cognitive decline. Dementia is the disease occurring due to the major cognitive decline that gradually affects the individual's activities of daily living. About 6% of elderly women aged 70 years and above and 1% of women aged 50 to 69 develop disabilities due to dementia. Age and sex are two important factors that influence the incidence of dementia, with women more likely than men to develop dementia, and incidence of dementia increases with age. Menopausal women also experience chronic respiratory diseases as a major health concern. Chronic respiratory diseases is a progressive lung disease that develops as a result of breakdown of lung tissue, thereby obstructing the airflow, especially in the small airways. Some of the most common chronic respiratory diseases are asthma, chronic obstructive pulmonary disease, which is commonly referred to as COPD, lung cancers, cystic fibrosis, sleep apnea, and occupational lung diseases. Smoking, passive smoking, household pollution, etc. are some of the causal factors of chronic respiratory diseases. As we discussed about fluctuation in sugar levels among the menopausal women, diabetes is an important health concern. It is the most common metabolic disorder affecting people globally, and its prevalence is increasing due to the rapidly growing aging population as well as increasing lifestyle disorders. It is a group of metabolic disorder in which there are high blood sugar levels over prolonged periods. Some of the symptoms include increased urination, thirst, weight loss, fatigue, nausea, etc. Diabetes increases the risk of developing various other chronic conditions and disability if not treated promptly with medications and lifestyle modifications. Another important health concern of menopausal women are sleep disturbances. Sleep disturbances, that is, changes in the quantity and quality of sleep, are very common among these cohort. Sleep disturbances are a consequence of hormonal disturbances experienced during this phase of life, which has detrimental impact on their overall quality of life. Sleep disturbances tend to disturb the metabolic and physiological functioning, which leads to mood swings, decreased concentration, increased irritability, among various other symptoms. Diagnosis and treatment of sleep disturbances is often difficult. Hence, this interferes in proper functioning of their bodies, leading to risk of various other physical and psychological disorders. Migraine is another condition, a major health concern experienced by women in the menopausal stage. Migraine is a complex condition with a wide variety of symptoms. Though various environmental and behavioral factors are observed to precipitate migraine, the actual cause is unknown. Though migraine occurs in both sexes, women tend to be more prone to migraine as compared to men, with a cumulative lifetime prevalence of 43% among women and 18% among men. Hormonal disturbances in perimenopausal women tend to increase its risk. Depression. Depression is a common but very serious mood disorder which causes severe symptoms that affect the feeling, thinking, and activities of daily living like sleep, eating, working, etc. of women. Some of the symptoms include being persistently sad, being anxious, empty mood, pessimism, feeling of hopelessness, irritability, decreased energy, feeling of fatigue, difficulty in concentration, sleep or oversleeping. Extreme cases may also have thoughts of death or suicidal attempts, among various other symptoms. Depression is more common among older women as compared to men, and it may co-occur with other serious illnesses like diabetes, cancer, heart diseases, Parkinson's disease, etc. As we have seen that menopausal women experience a range of health concerns. Hence, interventions are important both at the individual level as well as the policy level. So let us look at the interventions which will be useful to address these health issues due to menopause. At individual level, prevention and promotive interventions are essential, which includes making lifestyle modifications like including exercise, yoga, meditation, which will improve the metabolism and keep the sugar levels under control, and it will also improve both physical and mental well-being of menopausal women. Healthy eating habits, a balanced diet, and foods, including foods which are rich in estrogen, for example, soya products like beans, soya milk, vegetables like celery, parsley, beetroot, broccoli, cauliflower, carrots, cucumbers, mushrooms, and including fruits like apples, cherries, olives, pears, plums, tomatoes, oats, etc. help in reducing symptoms like hot flushes, apart from improving the skin tone and the hair in the menopausal age. It is also important to include foods that are rich in calcium. As the bone mineral density starts depleting rapidly in this phase, there is a need to increase the intake of calcium-rich foods, which will keep the bones in good health and delay conditions like osteoporosis. Increasing the water intake and introducing minerals and vitamin supplements along with lifestyle modifications also helps in maintaining good health in this phase. Another important thing to remember in these stages is periodic preventive health checkups, which are most important to screen cancers like cervical cancer or breast cancers and other menopausal related metabolic diseases like blood pressure, cardiovascular diseases, etc. Because early detection of a disease is the key to improve the prognosis of the disease. Access to quality health care is important to improve the diagnosis, which will improve the prognosis of the disease. Now let us look at the policy responses which have already been there to improve the health issues of the menopausal women. The latest National Health Policy of 2017 attempts to address women's issues across all age groups by enhancing the provisions for reproductive morbidities and the health needs of women beyond the reproductive age, that is 40 years and above. In addition, the policy also supports an integrated approach where screening for most prevalent non-communicable diseases like screening for oral cancers, breast cancers and cervical cancers, in addition to chronic obstructive pulmonary diseases, that is COPD. The policy will also focus on screening for hypertension and diabetes. These kinds of secondary prevention would make a significant impact on reduction of morbidity and preventable mortality. The policy also aims to incorporate a comprehensive primary healthcare network with linkages to specialist consultations and follow-up at the primary level. The policy also aims to improve access to medication and access to select chronic illnesses on a round-the-year basis. So to conclude, this module clearly highlighted that the average age of menopause among women in India has reduced from 50 years to in the range of 46 to 48 years. Women experience a wide range of symptoms during the menopause that affect their overall quality of life and increases their risk to a range of diseases like cancers, dementia, heart diseases, diabetes, metabolic disorders, migraine, mental health issues like depression, etc. Hence, a multi-pronged approach which includes preventive, promotive and curative interventions is required to address these health issues, which lay stress on the role of lifestyle modifications at the individual level and the role of active screening at the population level. The National Health Policy of 2017 in India has made an attempt to acknowledge the need for focusing on women aged 40 years and above and has laid strategies for active screening of non-communicable diseases like cancers, diabetes, hypertension, etc. to improve the quality of life of menopausal women. Thank you.